Okay, so the title of my project was Working with the Nurse Educator and Experienced ICU Nurse. I know it's a little bit hard to see my slides, but this is the best I could get it. So basically my clinical site was I followed two different clinical people. So the first one was a nurse educator of the ICU setting. Um, and then the second person I followed was a MICU nurse who was an experienced nurse. So it was a great experience. I got to learn a lot and it was a very good interaction. Okay, and then so the nurse educator, her daily life was pretty much, making rounds, interviewing possible new employees, also, transitioning those nurses, the new nurses, and transitioning ones to become ICU nurses. So I got to see the daily life of how she does that, what kind of clinicals they go through, preceptorship, grand rounding that they also do. And then I also got to see like the new evidence-based project that they're working on, which was pretty cool. I also followed the ICU nurse, which was in MICU. So I followed her for 2 days, 12-hour shifts. It was very interesting. So MICU is the medical intensive care unit. So we got to see a lot. Then got to see like the nurse to patient ratio, how she manages her time, um, what kind of patients they do have, how they work with the nurse educator together, and also how they're also both working together to get that project going. So it's very interesting to see how they communicate and a lot of teamwork. Okay, my learning goal was to learn how the new nurses and transitioning nurses um, in the ICU setting get ready to start ICU. Okay, my first learning objective was to identify and explain the transition process of the new nurse and of the critical care setting. Next, identify how the units promote holistic standards of care in the medical staff and use all the staff in the grand rounding and how they kind of come together to give that patient care. Next, I used how to identify the ICU nurse educator and how the ICU staff nurses work together in giving that safe quality of care that everyone really wants to get. So meeting my objectives. I met those by first observing the teaching of new ICU nurses, how they transition, reviewing the modules and criteria along with the preceptor until a new nurse or transitioning nurse can work alone and feel comfortable working alone. Next, I observed grand rounding, so basically got to see all the different specialties and services come together, see what they each bring to the table, going over the plan of care for the patient while they're in the room with the patient, so it was really unique to see, as well as shadowing a nurse educator like I did and shadowing an ICU nurse, see how they separately work and then how they come together to work as well to give the best practices. Okay, and then relating all of this, what I have been learning, to the literature, um, basically, first, working at a hospital, you got to see kind of what their standards of care are. Always ensuring high quality of care and patient care, which you want safe care as well. You need to make sure they take extra steps to make sure this happens, which the hospital definitely did take those extra steps with the process, observations, outcomes, so much. So they have to always be prepared for the unexpected. In the hospital, many things can happen. You never know. Always have to be on your toes and ready for that. Preoccupational failure. So no one is perfect. You just have to make sure your nurses are trained well, which I got to experience a lot in the hospital, where these nurses are very much trained. And when I got to see them being trained too, like the new nurses, they're giving all the education, the courses, the modules, everything like that to get trained and to expect the unexpected. And then with reluctance to simplicity, you got to look at the root cause of problems. So an example was just like if a medication error would occur, you got to, if there wasn't the right dose, something like that, you got to go back all the way back to pharmacy, see why it didn't occur that way or the right dose, etc. Make sure all the rights are right. So you got to look at all the underlying process, which this hospital definitely did. Also, sensitivity to operations. So it's all the environment that affects the nurses, like, how clean the environment, what's going on, chaos, working stuff, everything, because it can all affect on how the nurse functions, especially influence if there's any medication errors. Okay, so you got to take those steps to prevent the errors, which also, this hospital definitely was always making sure their nurses felt very comfortable. Um, a lot of staff meetings and whatnot. Resilience. So you got to anticipate failure. No one is perfect. I felt like the managers and everything at the hospital here, we're human, so we're going to make mistakes, but we just got to make sure that we do our best that these mistakes don't happen. And then if they do happen, you learn from mistakes. So, near miss events, they always had meetings about these where a mistake almost happened, but it didn't. So it could have caused harm. You got to really make sure and reduce harm. Like simulation, what could have happened, what could have done, which they do a lot of simulation cases um, at this hospital with the new nurses and transitioning, like the modules and even codes in case something were to happen. Okay. And then next to patient safety, you strong leadership. So you have to have leaders who, know what they're doing, have to really be able to rely on them, because if something were to happen, they're the first person you're going to go to. You got to go up to chain of command. So I really felt like the leaders here, they're very, easy, accessible, and very, where you can go up to them like, hey, I have a problem, which is very nice to know. I really saw the teamwork, everything like that. So it's very good to have strong leadership, in case of the unit so it runs smoothly. Also, structure. I saw in the hospital, it's a very clean environment, good working environment. There's staff guidelines, which are strict, but it's not overly strict where it's not a good environment to work in. Culture, you also have to take into culture. There's so many different cultures working in the hospital. Also, you get so many different cultures, coming into the hospital. So you have to be very culture sensitive, which these nurses, they've experienced a lot. You have to mind no judgmental stuff like that, which I felt like it was done very well. Assignment sheets. The nurses always, when they first went to the office, or the unit, I guess, will get their units, their assignment sheets, what patients, patient to ratio, which the MICU, which I was in, was only like 2 to 1, unless they had a downgraded patient with other patients. So it was a very fair, reasonable. And supervisor support, which the charge nurse would always help the nurses, especially newer ones, if they needed help for anything. If a patient were crashing, they were super busy, or had 3 progressive care patients. That was very good to see. Okay. Process. So the process is basically like delegation. So it's when these new nurses and transitioning nurses come in, more delegation to the CNA, stuff like that, which, it's pretty basic nursing stuff is delegation, which they were really good. But actually, it was funny. The MICUs that I was in did not have any CNAs, so they did all the care, which was wonderful, but they just have to help each other. Evidence-based practice. So it's the best practice that they have done and seen and reviewed, everything like that, and make sure it's good. And then it's like standards of care is linked with that. And then priority setting. So it's kind of what kind of care you give first. What prioritize your kind of care, what needs to be done first. Obviously, ABCs, and then, medications, high risk, and go on your way down. But, just don't forget that, infections and bathing and stuff like that, it needs to come too in a timely manner. So which I saw done. I helped give mini baths, clean patients, which is wonderful. The nurses are also very nice and helpful. In teamwork, they were so great at teamwork. They helped each other, and they even were thankful of me too to help, because I had my little nurse and she was so thankful of me to help her too, which was wonderful. Next, looking at outcomes. Okay, so patient-centered care. It always needs to be the priority of the setting. You want to make sure they always come first, and everything we do is for them that's given safe quality of care. As well as satisfaction. We got to look to make sure we're giving good care too, but it has to be satisfactory care. So that my nurse educator manages all that, how well it's satisfied, how well the nurses are satisfied too, kind of goes back and forth. As well as safety for the patients and staff safety. So you do want to keep our patients safe, but you want to make sure yourself is safe first. So they always took the measures like standard precautions, PPE like that, um, glove up, wash your hands, stuff like that, hand hygiene, and then safe patient handoffs to make sure you're going over everything. And a lot of the times too, night shift will come and get the same patients, but you should still go over that and never assume a nurse knows, which they always did. They did great SBAR handoffs. And then infection management too with my nurse educator. I got to see how she does that. Go over like, PICC lines, stuff like that, what all needs to be done. They have standards of care. Certain days they change wounds. Everything needs to be met. So that was wonderful. Okay, and then next was interprofessional teamwork and collaboration, which was just how everyone comes together to give that patient care that we want that's safe and quality. Um, so working together as a common goal to take care of the patient, which there's so many people in the hospital. It was great to see everyone. The RTs rounded continuously in the ICU, helped and then when we extubated a patient, even they were right there at the bedside with you, which they should be, which was great. And they had their hospitalists, intensivists, everyone on the unit if you need them. Also rapid response. ICUs, they typically have, all the doctors, stuff like that. But if you do need the rapid response, it's more for the other settings. But it's always there if you need it, which was some of the times the charge nurses would take breaks being charged and just go in rapid response. And whenever they called one, they would go wherever they needed to go, which was great. SBAR, which is, the handled situation, background assessment, everything like that. So just giving a good, assessment of the patient and giving that good patient handoff to the next nurse. Because some nurses are a little bit less experienced or more experienced, so everyone wants different things, which I kind of saw my nurse's style. And she was very good at handoff. And then my nurse educator too, she'd kind of explain to the newer nurses what you really need to tell in the SBAR, and it's very important. And then reflection and feedback from all the nurses in the meetings was always communicated and encouraged. What can be done for the unit, what can be done for the patients, what needs to be brought up, stuff like that. Also, grand roundings, like I said, they included everyone on the unit, which didn't happen on the weekends, but they still did pretty big roundings. But on the weekdays when everyone's there, it's really wonderful. They go in the patient's room. They include everyone to diet, PT, OT, CNAs if they have them, everyone, include the patient and the family, and talk about the plan of care. What needs to be done, short-term goals, long-term goals, which I thought was amazing. And any issues ever, they always told me to just go up the chain of command, which they've done before, but it's a very open communication, and the supervisors give them very good support. Any other issues, just go up, like I said. And then like the preceptorship for the new nurses is a little bit longer for a preceptor just because they're so new in the ICU. You really need that experience. And then transitioning nurses, depending on their experience, they'll have a preceptor as well, just a shorter amount of time. Okay, next moving on to patient-centered care. So my hospital's term, like their logo basically was called I Care, just basically saying that they, they're a hospital, they care about each individual person. You're not just a disease, not just a piece of paper, you're there and they want to take care of you very well with the best evidence-based practice, quality, and safe care. So goal of the hospital, so follow to strive for nurses' care and ensure nurses do so as well. They want to make sure that they always advocate for their patients. A lot of times with ICU patients, sometimes they're intubated, they can't talk, they have delays, just you never know what's going on. So you really got to look at all the nonverbal cues, see what's going on with the patient, and just, get their family involved and see what can be done to maybe make them more comfortable, or try different things, talk to their physicians if you notice something that they might not notice since you're always at the bedside. So, and you got to really understand what the patient and the family is going through. I really noticed the nurses I saw and I was with really cared, always tried to include everyone, let them know what was going on, because that's the best way too. Even if the patient might be in a coma, always talk to them, let them know what you're doing, stuff like that, which I saw, which is really great. And then, it's tough too, because ICU, you never know what you're going to expect. You got to have that, professional line where you care, give sympathetic and empathetic communication, but also you need to make sure you don't go over the line. You can show emotion, just be professional, is what I saw, and always was taught by the nurse educator. Okay. Culture, you got to always be careful about culture, not overstep your boundaries. Different cultures believe in different things, so just always respect it. Don't push, don't assume, and don't judge, which was also taught to me. And then also constant care for those patients to challenge themselves. Like if they're intubated, try to go down on their propofol, see if they can wake up, stuff like that. Mouth care to prevent infections, just anything that could, challenge them, get them better, even downgraded from ICU so they can get one step closer to go home, which she showed me some of the things that they can do, which was awesome. And then you got to keep your patient data safe. HIPAA violations, you just don't want that data to show. And then also the nurse educator she monitors all the satisfaction. She goes over surveys, sees their ratings, what they can do to improve that, goes off the comments, everything like that, which is wonderful. And then just quality of that care. Okay, and then the last thing that's related to the literature is informatics. So the hospital I was at too, very high-tech place. They had a lot of, their, ventilators, very high-tech, so cool. They had all the patient charting right at the bedside computer that just pulled down. So it was, just sit there charting at the bedside, which you don't have to leave, which is also will carry on to something, especially if they're in isolation. You don't have to move that in and out, which was wonderful. So it's very high tech, very fast, easy accessible, and ready for it to go. So, all right. And then best practices. Best practice states transitioning new nurses type of residency program like they were teaching. Okay, be given a preceptor, learn, and work with it to give the best experience. Work as a whole team, not just a single person together, even create different roundings, so they'll go visit PT one day, go cath lab one day, ICU, neuro, see everywhere to get that rounded nurse. Complete module simulations, which is also what they teach and created for the new nurse and transitioning nurse. Also class time to sit in and learn about each body system and have little quizzes and tests over them, which obviously she would help if you needed to. And then review the standards of care. So wherever you were going, they printed out standards of care policies. So this was given to you at the very beginning, so you knew what you were expected. They would go over the roles, expectations, everything like that. And obviously, if you need more time for preceptorship, which new nurses would get a longer, and transitioning nurses less time. Okay, and then definitely they were used at my clinical site, like previously stated. Always a team effort in every way. Modules, like I said, were given, standards and policies were given, and best practices were used. And then the new graduates sometimes even entered a contract, so just to make sure that they stay in that residency program and things like that. And reflection. So overall, I loved my clinical sites. It was so cool to see the nurse educator in action, seeing medical students to teaching the classes, even giving me refreshers on some things, so you can never stop learning, which I loved. She was very smart, educated, fun, and witty, so it was really interesting to just walk around, tour all the different ICUs and how she knew everyone, so it was really awesome. And then, staying with my preceptor in the MICU was also pretty cool. I've never been in an ICU or worked in ICU, so it was really cool to see how that works, time management, the patient care. You really have to stay on your critical care. These patients can tank at any time. So they were all so helpful and really, supported me, congratulated me on my BSN. So I had a really great experience overall. And I'm thankful for this year. All right, and these are my references. All right, thank you so much.